Hello, my name is Chris Chappell. I'm Professor of Urology at the University of Sheffield and at Sheffield Teaching Hospitals in Yorkshire in the UK, and I'm also Secretary General of the European Association of Urology. Incontinence is a major problem in the female population. Indeed, up to 1 in 3 women following childbirth develop incontinence. Against the backdrop of the consequences of childbirth, there is also a prevalence of the so-called overactive bladder symptom complex, which is defined as urgency, frequency, urgency incontinence, and nocturia, which is sleep-disturbing voiding, which increases with increasing age. So unfortunately in women, there's the consequences of childbirth, which leads to pelvic floor weakness, and in some women to sphincteric damage, with against that an age-related prevalence of increasing storage symptoms, which are evidenced by overactive bladder symptom complex. If you put all that together, then you have a very complex admixture of both storage symptoms relating to intrinsic abnormality of the bladder and sphincteric weakness due to pelvic floor deficiency and lack of support to the pelvic floor, as well as intrinsic sphincter weakness due to damage to the sphincter mechanism itself. And this is very common in most countries. It's particularly common in India because of the high incidence of childbirth, and many women will have a number of children, and of course this therefore is manifest with a greater tendency towards the development of sphincter-related problems and prolapse. Overactive bladder is a term. Now many think upon this as a condition, but it's not. It relates to a non-specific symptom complex, as I've mentioned earlier, related to urgency, which is a pivotal symptom, which is a desire to void, which is difficult to defer. If you get that urgency, then you need to go more frequently to the bathroom, and if you don't make it in time, particularly if you're female, then you may develop urgency incontinence. Now many people think this is just a female condition, but it also affects men. Indeed, these storage symptoms are the predominant reason why many men with benign prostatic hyperplasia leading to enlargement of the prostate, so-called BPH, actually present to see us as urologists. And so it's in the context of this, I'm sure you would agree with me, that these storage symptoms are a very important factor that needs to be addressed. As I've mentioned, the symptoms of overactive bladder, which is a non-specific symptom complex, relate to failure to store urine. And there's no doubt that it increases with increasing age, so that certainly by the age of 70 in both men and women, you have at least a 60% prevalence of this storage symptom complex. Now women, of course, because of the weak bladder outlet, incontinence does occur in 1/3 of women with overactive bladder symptom complex, but is relatively uncommon in men unless there is associated detrusor or bladder overactivity, which can be defined on urodynamics. Now many people feel that overactive bladder and detrusor overactivity are one and the same thing, but that is not correct. Because indeed, if you look at the evidence, if you look at women for instance, only 40 to 60% of women with overactive bladder have detrusor overactivity, and the 40% is in those that actually don't have incontinence, the 60% in those that do have incontinence. In men, the equivalent prevalence of detrusor overactivity is between 60 and 90%. So if you have a male patient with incontinence and these storage symptoms, they have a 90% chance of having detrusor overactivity. So very clearly you can see that this is an important healthcare issue because it interferes with quality of life to a great extent. So certainly the problem here is a misconception. The standard of care after you've tried health modification, lifestyle modification, losing weight, reducing fluid intake if you've got these symptoms, is to actually use pharmacotherapy. And the standard of care in the past has been the use of drugs affecting the cholinergic neurotransmission, so-called anticholinergics. Now most people, even many doctors, think this is because the drug is working on the detrusor muscle, but in fact that is incorrect, because the target for all pharmacotherapy is actually the sensory system, the afferent system, because at the end of the day it's a sensory symptom, urgency, a compelling desire to pass urine, which is difficult to defer, which is what you're targeting. And the same applies for anticholinergics, which in fact are acting on the sensory nerves and the interstitial cells in the bladder. Also applies to Botox, which actually is acting the sensory nerves, sacral neuromodulation, and if you're talking about the other more recent pharmacotherapy, beta-3 agonists, this also acts on the sensory system. And by virtue of the fact it's not acting on the detrusor muscle, for instance, you don't see retention with this drug, with similar efficacy to seen for the anticholinergics. And it's recognition of this for the future which is driving new research into the ways in which we can modify the afferent system. So for instance, there are two drugs, capsaicin and racinofetoxin, which are not marketed because of either the effectiveness, causing retention for 6 months with capsaicin, or difficulties with delivery with racinofetoxin, which have stopped them being introduced because both of those do not act on the detrusor muscle, but act on the sensory system, and they can cause complete retention and abolition of this sensory voiding reflex. So if you like, that's proof of the pudding that you're not targeting the muscle, but the sensory system. So future research will be based on trying to understand better how to deal with and target the sensory system for the future to improve the quality of life of our patients, which is particularly important as we're seeing this as a condition, overactive bladder, which affects the aging population with increasing prevalence, and as we all have more aging populations, it's going to have much more medical and healthcare implications for the future.